Can your zip code affect your chances of getting COVID-19? Stay tuned to find out. Hi everyone, this is Team E001. I'm Aarthe and my teammates are Selina, Pegah, and Fadoua. We know that New York City is the most populous and population-dense city in the United States. It also has a very diverse population. By analyzing geographic, demographic, and behavioral patterns in the population at a zip code level, our goal is to try to see if there's a relationship with the COVID-19 outcomes for that same zip code. We calculate something called increase rate for each zip code as the average daily increase in the number of COVID-19 cases calculated over a period of 1 month. Keep this in mind because we're going to use it a lot in this presentation. Our problem statement can be divided into 3 parts. The first part is to group New York City zip codes into clusters based on a variety of demographic and location-based features. The second task is to identify whether there are similarities in the rate of infection for zip codes within the same cluster. In case these zip codes don't exhibit the same pattern, we want to examine whether there's potential for certain zip codes to follow the pattern of infection of other zip codes within the same cluster. Essentially, the research question we wish to answer is, how does the rate of increase of new COVID cases differ across various zip codes in New York City based on demographic patterns? The goal for our analysis is to find an optimal cluster partition that better reflects increase rate trends. We propose the following unsupervised machine learning pipeline. We start with data collection where we use demographic information from the Census Bureau and city bike and New York City subway data in order to account for mobility information. Next, we perform pre-processing in order to make all of this data at the zip code level. We had 240 features and we performed feature selection methods like relief and correlation in order to reduce our feature set down to 113 features. We performed k-means clustering on 113 features and we selected 8 clusters using the elbow method. In order to make our features more interpretable, we categorized them into 7 feature categories and then mapped this using TSNE 1D embedding in order to aid our analysis. Our assumption is that regions with similar social and demographic behavior are more likely to exhibit similar COVID outcomes. We gathered the number of new positive cases recorded daily in New York City by zip code between April 3rd and May 14th, 2020, and used this to define the average daily increase rate of COVID cases. You can look at the diagram on the side to see how it changes with time. In order to improve the interpretability of our features, we grouped our 113 selected features into 7 categories. There were some interesting findings which we obtained. Mobility features such as the commute time, dwelling, subway stops, and city usage are very important. Families with young children are more likely to get affected. Male and females above 40 years of age are at high risk. People who are working in transportation, sales, retail, and armed forces are also at high risk. Poverty and low income are highly correlated to the trend. When it comes to race, Asian and people who identify as other race constitute a strong factor. On the visualization on the left, we have plotted all of our clusters in 2-dimensional space using t-SNE. Each point refers to a unique New York City zip code, and each color represents the cluster to which it belongs to. These clusters are also ranked in increasing order of increase rate. The diagram on the left shows the New York City map and how these clusters are distributed. Here we have 7 box plots for each of the underlying factors along with the target grouped by cluster ID. We notice some obvious trends here. Mobility, age, and income are highly correlated with the IR rate. There are 2 maps in this slide. The one on the left-hand side shows the cluster distribution, and the one on the right shows how IR changes over time. If you look at the map on the left, we notice that clusters 0, 1, and 2 occur closer to one another, and the same locations on the right-hand side show that these locations have a lower risk of getting infected. If you look at clusters 5, 6, and 7 on the left-hand side map, we notice that these are concentrated together and the same location on the right-hand side map has a high risk of IR. We also notice that as time progresses, zip codes with high IR appear to be increasing COVID cases in its neighbors. Based on our analysis, there's substantial scope for future development. A tool could be developed to manage and support health emergencies. Governors could be assisted to set policies according to risk-prone zip codes. A prediction model could be formulated in order to predict which areas are at more risk. Similar approaches could be tested for other megacities as well. The project code and data are available on GitHub in the link below. Thank you.